So I found a lump. I've had cysts before, and I thought it was a cyst.
I've had a mammogram and a blood test, and that's when they found it.
I was just thinking I was going to get results of the scan on my ovaries, but then he said, yes, we've found that you've got breast cancer.
I was 70 last year when I had the fated mammogram that told me I got cancer. I had a routine mammogram. The main thing I was thinking was, oh, this is the last one I get automatically. And I said to the lady, well, don't people get breast cancer over 70? And she said, oh, yes, of course they do, but this is the last routine one, and if you want, you're welcome to have another one. But then, of course, I got the letter saying, you need to come in and, we found something, come and be tested, and that started the rocky road.
I basically woke up one morning with a sharp pain, which followed with a dull ache. When I felt around that area, you could actually feel a small dip in the breast. So I went to the GP, who then referred me to the hospital to get tested.
They discovered that I had breast cancer, so that was a total and utter surprise, shock, and yeah.
When they did say that they were suspicious, I suppose, and then they put clips in and were taking biopsies, that's when you think, actually, this is not how it should be.
Obviously I was scared, it's not something you want to go through.
It's the big C sort of word that everybody doesn't want to hear about.
My family have been great as well as not so great. Some of them haven't coped as well as I would have hoped they would have.
The impact on the friends and family was harder to deal with sometimes because it seemed to affect them more. They seemed to worry more than I did with it.
I sat people down separately and I started the conversation with, it's going to be okay, then told them the diagnosis and what the treatment plan was.
When I first went for the chemotherapy, it was the unknown, didn't know how you was going to feel.
I'd always been warned about, from people I'd spoken to who'd had it, that it's not a particularly pleasant experience, but that the drugs that they give you are very helpful usually, and they can be adjusted according to whatever circumstances you are experiencing.
I mean, obviously, losing my hair was a major thing for me. I had long hair. The first 4 rounds of chemotherapy were not as bad as you envisage it to be. The first few days you do feel sick. Once you finish chemo, a few weeks after chemo, you tend to feel relatively normal again.
So I have had in all 7 rounds of chemo. The first occasion my daughter kindly came with me and they let her in.
The surgery for my breast cancer, again, it was scary. Will people still see you as the same thing? Will I even see myself as the same person?
The nurses and the backup there explained what to do, the exercises to do, and this has helped.
The surgery itself was very straightforward, and all the actual sort of theatre staff were extremely good and very chatty.
As part of my breast cancer treatment, I took part in a few research studies.
I wasn't expecting to be invited to do any research. I just thought that research was done on other people. I didn't think it would be done on just a normal breast cancer patient.
It felt like it was worth it, and what I was really pleased about was to get the result, to know that it wasn't hereditary in my family situation, because my daughter was naturally very worried.
When I was asked to take part in the trial, it was a no-brainer. I was told that for this particular one, I would just have a tissue sample taken. Well, I was under anaesthetic then. They're going to take it all away. Why not use it for research? Not a problem.
My breast cancer was 5 years ago, but 5 years ago, before my breast cancer, there were people doing these clinical trials, and my treatment would have been adapted because of the trials that those people would have taken. So For the future of breast cancer, I think it's really important.
I would encourage anybody to go down that route if they ever got asked to do it, because it's, without the research we're not going to move on and make the progress we are making.
I would recommend others to take part. The more people that take part, the better it is for everybody. The more people that do research, the better it will be.